Hello everyone. In today's class, we're going to see some real ECGs and we're going to learn how to interpret these ECGs. Today we will discuss about three different ECGs. Let's start with the first one. If you look very carefully in the ECG, the rhythm of the heart rate is irregular. Not only irregular, it is irregularly irregular. Look at lead 2. You will see the RR intervals are varied. Okay, some are long, some are short RR interval. And one more important thing is that there is no P wave, no definite P wave preceding the QRS complex. Okay, so the absence of P wave along with varying RR interval suggestive of atrial fibrillation. In atrial fibrillation, the baseline is usually ragged or there are very fine undulations in the baseline. So this particular ECG is of a patient of atrial fibrillation. Let's move on to the next ECG. Okay, in this particular ECG, okay, you look at the ST segments in different leads. Okay, if you look at the ST segment, you will find that there is elevation of ST segment, okay, in lead 2. This is lead 2. Slight elevation of ST segment in lead 2. Then in lead 3. Okay, then in lead AVF. Okay, and there is also presence of reciprocal ST depression in lead 1. This is lead 1, in lead 1 and lead AVL. Okay, if you look at the chest leads, there is slight elevation of ST segment of 1 mm in lead V1, okay, and in lead V2. So from this we can know that this is an ECG of ST segment elevated MI involving the inferior wall, because there is elevation of ST segment in lead 2, 3 and AVF, which represents the inferior wall. But along with the elevation in lead 2, 3 and AVF, there is also ST segment elevation in lead V1. Ideally, when there is inferior wall MI, ST segment elevated MI, then there should be reciprocal depression in V1. Since there is no depression in V1, rather than there is ST segment elevation in V1, so we should also think of the right ventricular infarction. And for confirmation of right ventricular infarction, we can take the right-sided chest leads and confirm. Okay. One more very important thing is that if you look at lead 3, okay, lead 3 seems a bit clearer. If you look at lead 3 and you look at the P wave and QRS complexes, you will find that there is no definite relation between the P wave and QRS complexes. Okay, this is a P wave, this is a P, this is P, this is again P, this is again P. This one is QRS, QRS complex, QRS complex. So, as I have mentioned, there is no definite relation between the P wave and the QRS complexes, though the interval between the P waves are same. Okay, and the interval between the QRS complexes are same. That means the atria is contracting at its own pace and ventricle is contracting at its own pace. That means there is no relation between the atrial and ventricular contraction. So this is suggestive of complete heart block. Okay, so this particular ECG is of a patient who is having inferior wall ST segment elevated MI with possible involvement of right ventricular wall along with complete heart block. Okay, let's move on to the next ECG. Okay, in this third ECG, if you look carefully, you will see some bizarre QRS complexes. Okay, I'm talking about these complexes. Okay, these bizarre QRS complexes. These are what is known as VPC, ventricular premature contraction. Now, how to diagnose a VPC? We have already discussed in previous classes. To diagnose a VPC, it should have a bizarre form. Okay, the QRS complex is bizarre, it's wide, and there is no preceding P wave. And very importantly, there is a discordant relationship between the QRS complex and STT segment. By discordant relationship, I mean if the QRS complex is positive, the STT will be negative. Okay, if you look at lead V2, if the QRS complex is negative here, the STT segment is positive, means upwards. So this is known as the discordant, or the opposite relationship. So this is an ECG of ventricular premature contraction. But again, if you look very carefully, the VPC, or the ventricular premature contraction, is coming at a regular interval after every second beat. Okay, this beat is normal beat, this beat is a normal beat, and the third beat is VPC. Okay, after 2 normal beat, there is 1 VPC. This typical pattern is known as ventricular trigeminy. There is something also known as ventricular bigeminy, which is commoner than ventricular trigeminy. In the ventricular bigeminy, there will be the VPC will follow every normal beat. That means after every normal beat, there will be a ventricular premature contraction, and that is known as ventricular bigeminy. Okay, so this is about VPC or ventricular trigeminy. Thank you.